The purposes of this video are to educate the audience of gaming in healthcare, present an example of a serious game that can benefit nurses, and provide goals for educating nurses in a simulated real-life setting.
Since the healthcare industry is a continually transforming process, it is necessary to incorporate the latest technology into the education and practice of healthcare professionals, in this case, games. The main purpose of serious games is to allow opportunities to practice, develop, and maintain health-related skills in an engaging manner. Specifically, the use of electronic gaming systems has enhanced the skills of nurses and the quality of life of the patients that they care for. Gaming in healthcare technology has increased the experience level of nurses, allowing them to more efficiently cater to patient needs and properly handle patient information.
One of the most important goals of nursing education is to prepare the student nurse to provide high-quality patient care in a safe environment. Serious games provide experimental learning situations for nurses without placing real people at risk. While playing the games, the nurse has to think quickly on their feet. One type of healthcare project being developed by HCC graduate students at Clemson is called Rapid Response. This helps nurses judge patient deterioration and provide immediate care.
Hi, my name is Lauren Carrico Dukes. I am a fourth-year PhD student. I work with Dr. Hodges in the School of Computing, and we have developed this system called the Rapid Response Training System, and what it's designed to do is to teach nurses how to recognize the symptoms of a rapidly deteriorating patient. These symptoms include things like changes in blood pressure, changes in level of consciousness, simple changes like changes in heart rate or temperature or input and output, all these small things that nurses should be able to recognize to keep that patient from rapidly deteriorating. Hospitals have teams called rapid response teams that if a patient is in bad shape and they see this deteriorating trend, the nurses can call those teams and help get the patient on the right track before they end up in the ICU or dead. But it turns out that nurses aren't recognizing these symptoms quickly enough, and so the patient usually ends up with a bad outcome. So what we've done is we've made some patients that simulate rapid deterioration, and we're going to test this out with nurses to see if they recognize these symptoms, and if they don't, which ones they're missing. And the good thing about this is that there's no risk to patients. So if we were to let nurses practice with real patients who were deteriorating or had the chance of deteriorating, then there's a potential that the nurse would harm that patient. With digital patients, we don't want to run that risk. So you can see, this is our patient. His name is Bob. So our goal is to try this out with nurses who are practicing the continuing education application. So nurses who are currently in practice now should be able to use this with the help of an instructor to figure out what they're missing in the signs and symptoms of rapid deterioration.
These were just a few examples of how gaming can provide nurses with the information they need concerning their patient. The world is shifting and revolving around electronics, and gaming is just one aspect. It is not only providing the healthcare system insight about patients, but also providing a means of education and a way for nurses to practice and perfect their skills. Adding a competitive factor to an education plan through gaming makes learning more fun and enjoyable than learning from a book or in a classroom. Overall, the use of electronic gaming systems has enhanced the skills of nurses and the quality of life of the patients they care for.